Chemical Brothers. I'm Shannon and Chris, and along with me is my other host, Chris Strathy.
Hey everybody, welcome back.
And we're so glad to be back. And today we are jumping right into our discussion in regards to substance use and addiction by talking about one of the main killers and one of the main problems continuing to increase in its problematic area of addiction, especially in our hometown, and that is fentanyl. Fentanyl is a drug that you can hear in two different ways. You can hear it in being used in the hospitals, and you can also hear it being used as a street drug. And usually when it's used as a street drug, it's used in a way that is very dangerous. And here's the reason why. In the hospital, medications in hospitals, or if you are being transported by an EMS agency to a hospital and you have experienced a traumatic injury and you are experiencing severe amounts of pain, fentanyl is a drug that would be utilized or given to you for pain. It's going to be given to you because there is a lot of less side effects in regards to other medications that may be able to be given to you. This medication is given in micrograms doses, very, very small amounts. This medication does well. I've used it as a paramedic in the back of a truck for patients who have had some sort of really bad traumatic injury. We use it because it, again, does not have that many side effects. And again, it's used in microgram doses. For street drugs, the lethal dose is going to be around 2 milligrams. And that is where the awareness of fentanyl is ultimately you're unaware of. Because when you take that medication as a street drug, you don't necessarily know how much you're taking. There's no way of finding out, or no way to know if you're taking the correct amount of dose.
You're not getting it from a pharmacist.
You're exactly right. and or a doctor.
Yeah.
So another thing too is this medication is also used to cut other drugs. It's used to put within other drugs to increase the high. And again, there's no known understanding of how much of that medication is in there. CDC reported that as much as 2/3 of the 100,000 deaths over a 12-month period a year ago were believed to be due to fentanyl.
So 66,000 people
That's good.
overdosed from fentanyl. I was quick with that one.
Yeah, that was really good.
Yeah, that's insane. Yeah, and just going back to the illicit side of it, to piggyback off what you said, if you think of it from a black market perspective, something so powerful that is, its weight is less, it can be transported easier, more bang for the buck, from a drug dealing black market perspective. So, one would wonder, like, why on earth would fentanyl be in this or that or whatever? And it's really just a matter of getting anything to a market that will get somebody high. There's no quality control in the black market, drug trade. It's just a matter of, this is something that one pill can equal, or one dose or 1 gram can equal a lot more money and a lot more highs for the end user in that game. So that's why it's so dangerous, and that's why it's in so many things that you wouldn't necessarily think it would be in on the black market side of things. Why would.
Well, I think that what we're trying to do today, because we get this a lot when we go and we speak or we share, we talk about where does fentanyl come from? Well, fentanyl is actually a medication that's used in the hospitals. It's very safe. It's preferred among other drugs. It's a very good medication for traumatic injuries, for pain, and it helps out a lot. So why is there such a problem with it? Which is the second question. The second question is because, just like anything, it's going to be misused.
Yeah, and I think the synthetic of just the little bit of views or the little bit of education I've done over the past week, because even I had some misconceptions about it. Black market manufacturing, we live in a country where supposedly most of that has really good oversight. The Food and Drug Administration, laws surrounding how you can manufacture, how you can handle it, how you can get that stuff. But, there's a recipe for it. The recipe was patented at one time, and then patents run out, and then there's generics being made. Well, in countries that don't have oversight or don't follow protocols to, know who's making it, who's stockpiling it, it's a real easy way for it to flood the black market. And I'm not going to throw country names out there because I'm not. I think we can just assume that any country that has the means to either look the other way while criminals are doing it, or to actually take part in it themselves through manufacturing and distribution. But it's just something that it's that easy when it's, we say here, it's fentanyl's made, it's a prescription drug, I was prescribed fentanyl personally. And I was prescribed it through a patch, which I found out that it's really actually hard to make fentanyl go through your skin. That was something that I might have even mentioned it on our first episode. So I don't want to fearmonger too much there. It's actually harder than I thought to get it to go through your skin. But they formulated it in a way that it was pretty hard to abuse, from a pharmaceutical standpoint in the United States. The addict isn't looking for a prescription for fentanyl because the way it's distributed, it's either in a microdose lollipop, which is like the fast acting, oh my God, I have a traumatic pain, I need instant relief. So it's not in a pill, it's in tell me the right term for that, but when it's sublingual. Sublingual.
Mm-hmm.
So, sublingually, you would just let that dissolve in your mouth, and that would go into your mucous membrane, into your bloodstream,
mm-hmm.
and do the job. The patches are a long-acting. Think they're either 1 day to 3 day, and it releases a certain number of micrograms through your skin. But these patches are nearly impossible to abuse.
Mm-hmm.
At one point, they had like a gel in them that some people would either ingest through their mouth or whatever, and there was horrible side effects at that point, and I don't know the dates, but they reformulated it into this mylar mesh patch that really couldn't be abused. Like there was no way you could chew on this thing all day long. There was no liquid to suck out of it. You stuck it on your skin and it released the medication for 3 days at a time as a long-acting pain medication. A lot of times it was like hospice care, cancer care, like a pretty powerful medication, but safe, like
mm-hmm.
you were saying earlier.
Mm-hmm.
In the medical industry, healthcare industry, there wasn't a lot of, misuse. It wasn't, nobody doctor shopped, or I think few people doctor shopped for fentanyl because it was hard to abuse. Like I said, it did its job as a painkiller. Now it still is highly addictive. It's an opioid, opioid, synthetic opiate. But in hospice level or cancer patients or extreme pain, it's a viable, safe, as safe as opiates can get option.
Yeah.
But then, like we're talking about, the whole flip side of that is it's safe because it's so hard to abuse. If it's prescribed and it's prescribed in a way that it's not easy to get off the streets. It's
mm-hmm.
prescribed for people that need it and aren't likely to abuse it. So the black market side of that is that it's such a killer. It's micrograms. It's, we're from an addiction standpoint, a street drug standpoint, you look at it and tell how much, it doesn't really matter what it is. It's kind of the weights are all the same.
Mm-hmm.
One, if you put 4 piles of 4 different substances, not long ago, they all might do something very different to you. They all might make you feel very different. But the general amount of what you're ingesting wouldn't vary greatly as far as, risk of overdose or risk of heart attack or whatever drug we're talking about. Just in general, I think that would be a fair statement. Well, this stuff is like 2 grams of, 2 crystals of salt to somebody that is opiate naive or a child or, that's enough to do a lot of damage.
Yeah.
So that's the struggle right now. A medication that's been around for a while and it's been safe and it's been used is now in who knows what. It's going through the mail. It's being pressed into pills or tablets. That's a common thing now in the black market is folks can Amazon the machinery that makes pills and tablets and the dyes that put the numbers and shapes in them and manufacture in their basements tablets or capsules that look exactly like what you would get when a pharmacist prescribed it to you.
Yeah. Just recently we did a parent presentation at the high school, and I had never seen a press before in my life. I'll throw this up here on the screen for those who are listening. Our local sheriff, who is working alongside of us in this battle, and he sees it every day. He talked about how the press is how these medications are getting used in things such as Xanax. Xanax is a medication people use for anxiousness, anxiety. They use it for some sort of mental prescription. And these medications, as you said, which are being misused, there's no known dose to it. They're throwing this fentanyl in here, and it very well could be, and it normally is, the lethal dose. And people who are taking this medication thinking that, hey, I'm taking some anxiety medication. I've taken it before. I've been prescribed it before. I may no longer have a prescription, but I've used it before. I trust this person. They're getting medication that is dosed with a lethal dose, and they are dying.
Absolutely.
Because of the press. Because they press it to make it look just like the medication that you're using.
You would never know unless you had a test kit, unless you were able to understand the chemistry or the pharmacological, whatever excipients, whatever drugs are in this tablet, because you can take a benzodiazepine or Valium, whatever, Xanax, however that looks, because people know what they look like. If somebody's been abusing a medication, they know what numbers, what a bar looks like, what a Perk 30, whatever you want to say. Those are all medical terms for real prescriptions and dosages. They know what that tablet looks like.
Mm-hmm.
So if another tablet looks exactly like it, and they think they're taking a benzodiazepine to relax or sleep better or to get the high that they're used to, and it's an opiate, they're done. Absolutely done. And so there's no thought of the end user in the black market drug world. It's all about dollars.
It's exactly right. I'm glad you said that, because that echoes exactly what our sheriff said. Yeah. Is that if you want to know why this is happening, money.
Yeah, fentanyl's cheap.
It's greed and money. It's cheap. It's cheap for them to make. They can buy it for a very small price and sell it for an astronomical price, and they make money.
Absolutely. And I want to say a scary fact to this will scare a lot of folks that don't know the addiction world, but in communities of addicts, when folks overdose, other addicts look for the medication they want some, because it means it was good. It means it was powerful. And that's really scary. It doesn't scare folks into, and I think that would relate more towards back when you have no idea what you're getting. But as far as the pill press, the reason for putting fentanyl on everything, it's not, like we just said, they're not trying to sell the addict that's addicted to Xanax. They're not trying to sell them something that's like Xanax. They're trying to sell them the cheapest possible thing that will make them feel good so they'll want more, not caring if that will kill that person or not.
No, it's not. It's evil.
Yeah.
And
absolutely.
if and you've seen it, I've seen it. People who are in active addiction under this spell of fentanyl, it is evil. It's
zombies. It's the zombie apocalypse. If you can see where it's prevalent in communities, especially West Coast, where there's real, homeless encampments or just parts of town where it's, high concentrations of addiction. It's not unlike methamphetamines where it's easy to spot a user that's been, there's physical attributes that happen over, a short period of time when somebody really gets cranking with methamphetamine. When somebody's using fentanyl like this and they're borderline overdosing every day, like they're pushing the edge, they look like a zombie.
Sure.
They literally, asleep, hunched over, standing up, drooling on themselves, zombie. This is what it does to people. And if they don't die and they wake up and kind of have some sense of normal thought, the only thought is, I need more.
Yeah.
Where can I get more? What can I do to get more? And that's the zombie apocalypse when it gets to that point. It's either death or more.
Yeah. And just to kind of give you a little story behind an individual that I know of that struggled with fentanyl. He first started out smoking marijuana at 12, 13 years old. He moved from, as he grew older, he began to steal his family member, his dad, his grandmother, his mother's nerve pills. And then he quit. He quit for about 7 years. I was able to get off nerve pills, and then he started taking meth. And he did meth for about 3 years, off and on. And one day, due to a life-changing experience for the bad, he picked up fentanyl. And his words, his statement to me when we met was, I was able to quit nerve pills. I was able to kind of walk away from methamphetamines. But fentanyl's the one that's got me. I cannot quit fentanyl. It is very highly addictive, and it is very deadly. And as you mentioned earlier, there's no way to tell how much you take. And as you said, 2 salt crystals, the end of a pencil, and I'll show this on the screen too for those who are listening. The end of a pencil, just the lead of a pencil, the end of it, is of fentanyl is enough to kill up to 5 people.
Insane.
And there is news broadcasts, you can see it, you can look them up, you can pull them up, where there is enough fentanyl pulled off the streets to kill the population of the United States of America.
Unreal. And believable at the same time.
Yeah.
I want to go back to something I said earlier about when addicts on the street hear of an overdose, they want to go after whatever dealer. And I mean, they want to get what that addict had because it must have been good. And I think that's in relation to kind of before illicit heroin was flooding the street, or illicit fentanyl was flooding the streets, and more of like heroin, opiate addiction through pills, couples with heroin, because a lot of guys, heroin was available, and when you couldn't get pills, that's what you would use. It's essentially the same opiate addiction. In my personal experience and my understanding, you're not going to be picky. You're not a fentanyl addict. If you can't get fentanyl, you'll get whatever opiate you can. It's just kind of the same receptors. It's the same. But back to what I was saying about the overdose thing. I think now fentanyl is such a problem because it's potent. You know, if you were you were an other opiate user. You know, you were prescribed something that you were abusing or hooked to, or, you know, this is the high of the high. You know, this is right before death is, in big fat air quotes, the best high an addict can get. That's it. You're pushing that, you know, chasing the dragon. The first one is great. It'll never be the same, but it will always take more, or it'll always take something more powerful.
Mm-hmm.
And that's what, from an addict's point of view, I don't want Bud Light. I don't want the low carb, fun stuff. I want the hardcore. I want the stuff that's going to get me there.
Yeah.
The place that I've been chasing since the first use.
Yeah.
So.
And that's your body telling you that.
Sure, that's chemistry.
Yeah.
That's
your
chemistry
body. That's
telling you.
That's that whole dopamine push we've
Sure.
mentioned before, and what it does is. And I read a book in one of my classes in regards to drug counseling, is that we get small dopamine pushes all the time based on our pure joy sensor. Of course, if you want to learn more about this, you can you can listen to an Andrew Huberman podcast, and he'll tell you all about the dopamine push. But one thing I find very interesting is fentanyl has a 10% increase in dopamine. It's one of the highest pushes of dopamine increase. And so when that takes place in our body is totally automatically fixated on, that's what I'm going to use from this point on.
Absolutely. Well, and I think it's in the whole opiate realm, people, when they withdraw, they talk about pain. And that's, I think, in my understanding, in my experience, so if somebody had never experienced pain before and they started taking opiates, you hurt the second your body needs more, because that's the chemical reaction. There's no cause of that pain other than your body can't regulate without the medication you putting in it. You know, that dopamine, it's all natural. It's all, so you're throwing your whole body out of whack. Like I said, if your body didn't know what pain was, and a lot of people that get on opiates, prescribed opiates, have legitimate pain. But it's so hard to get off it because that pain's not going to subside, simply because you're now chemically, your brain's telling you it's not going to subside.
Mm-hmm.
So even if the cause of the pain, a traumatic injury, heals, your brain still hurts. You know, that pain is felt in the brain, not at the spot. So that's the horrible thing about this stuff. And then fentanyl, like you said, just times 10 that, or times 100 that, just makes it that much more difficult, that much more ugly for the addict. You know, the things they're willing to do, the lengths they're willing to go. And then on the black market side, it just makes it such a public health crisis.
Mm-hmm.
Like it's, the folks that I was talking about earlier that look like zombies, that are hooked on fentanyl and only want fentanyl and push that envelope, even though it's just a few grains of salt or an empty, or the end of a pencil, think of what an opiate naive person, somebody that never used, or a child that got into it, the amount it would take to kill them.
Yeah.
So it's really, it's a crisis. It's a huge public health crisis right now in Alexander County and nationwide.
Yes, 100%. And I think, and that's something you said earlier that I want to make sure that I do talk about before we come to an end today, is what happens if you come upon a fentanyl overdose, or you walk into a room where a fentanyl overdose has occurred, or by chance you pick up something that is fentanyl laced. You said earlier, it is actually extremely hard for it to absorb into your skin. That's 100% fact. Now, if you recognize that you've picked up something, well, first of all, don't touch it.
Sure.
Okay.
Absolutely.
Number one rule: don't touch it. But we're humans. You know, we like to. Oh, what's this?
Curiosity.
Curiosity kills us, and so we're going to pick it up. Immediately wash your hands. Mm-hmm. All right. Because the next step which we all do, is we touch our face, and we will eventually touch something.
Mucous membranes.
Mucous membranes, where it touches, where it will absorb
Absolutely.
the skin. Another thing too, and if that takes place, we want you to immediately call 911. Make sure that sheriff's office is called so that they can identify the package or material or what's taking place, and just be monitored because again, it is very deadly. It can cause signs and symptoms, and we'll talk about that. What are the signs and symptoms of an overdose? Well, everybody likes to first of all go to the constricted pupils. Hey, this person has constricted pupils, they have an overdose. We'd also, because it affects the chemical receptors in your brain, which is sending signals back and forth for your breathing, you could have decreased breathing. Those signals in regards to circulation, you have decreased circulation, so a person could start turning pale, they could start turning blue, signifying a loss of circulation. Breathing rate will tremendously go down to the point where they either are shallow breathing or they'll stop breathing. And then of course, the constricted pupils, and then an altered mental status. They're just not acting right. They're just having a weird. Again, I call 911. These people need to be either potentially given Narcan, which we'll talk about in another episode, and just be transported to the hospital for evaluation. Because fentanyl can rebound. You may be not clear it completely off the receptors enough, and it could block those receptors again, even after giving Narcan. That's why we talk about, wait 2 to 5 minutes to see if that medication reverses it, or if it comes back, then you might need an additional dose of medication like Narcan. So those are the signs and symptoms of an overdose. Those are things that you want to look for. And so be aware of those. Be aware of the situation. I can't remember what word you use in regards to fear-mongering.
Yeah, maybe, yeah.
A lot of times people are just so freaked out, and you should be. I'm not saying don't be, but I get it on my skin, wash it off, clean it off. Make sure you don't touch your face, because it is difficult to absorb through the skin. It takes several hours for that medication for your fentanyl patch to absorb through the skin.
Yeah. Well, and I think it's important that we, maybe next episode we'll talk about Narcan and pushing back on the stigma of all this. But really, I think next episode we need to focus on kind of what you just started on, signs of overdose, maybe signs and symptoms of opiate use, before it gets to overdose, family, friends, parents. I think it's time to start pushing back on the stigma. We've talked about signs and they could be horrendous, but we are talking about people. We were talking about sons, daughters, fathers, mothers, brothers, sisters, family members,
first responders,
lawyers, doctors, first responders, and they all deserve a chance to get better, and certainly a chance to counteract overdoses, whether they are accidental through, I'm sure they're all accidental, but accidental through an active user or accidental through somebody just coming in contact with something they had no idea was an opiate or fentanyl.
Yeah, and that's something that we can definitely pick up the next time that we come together.
Yeah, I think that'd be great.
Just make sure people understand what fentanyl is. That there's always a good side of it, but for something to be really good, there's also got to be a bad side of it. And that bad side is what we're continuing to fight. We're continuing to educate people on and let people know the differences. Just because you go to the hospital and the doctor says, I'm gonna give you some fentanyl. Don't be afraid of that. Don't be like, oh no, I could get addicted. The medication that they're giving you in that hospital is way more controlled. It's way more, in lack of better terms, diluted to the point where it's very difficult to, like you said earlier, very difficult to get addicted to.
Well, I may argue a little bit there. I think it's very, it would be difficult to get harmed by it.
Yeah, that's what
I think.
okay, that's good. That's a better. It's more difficult. You can't.
Yeah, for some folks, it only takes one, one taste of opiates to start down the road to addiction.
That's true.
That doesn't mean they're going to be textbook junkie a week into the deal. But I know for me personally, I had no warning signs of that whatsoever, and it was as innocent as I'm in agony, I need something, was given it. So again, it is safe. There is a use for it, but I'm also a guy to encourage people to avoid opiates at all costs.
Yeah.
So
yeah.
That's just, again, opinion, and I'm not
not arguing with
what
point.
you said. But
it makes a great point.
Yeah, it's
because you're right. It does. It is a lot more difficult to be harmed by it in that. So don't be something that, if your doctor's saying, hey, look, this is something we need to do for you, be aware of it. Just be aware.
Well, and that's it. I think with all your health care, it's really a matter of you need to own and be a part of your plan and educate yourself. So again, if opiates are something that's needed in your regimen then fentanyl is totally safe to be used that way. But again, the flip side of that would be if opiates are not needed, or they're recommended and you don't think you need them, good for you. Because I think that's removing a risk that doesn't always need to be there.
Yeah. Well, I want to thank you all for listening to us today.
Absolutely.
And I do apologize because, if you don't know, we are in the South and we are in the midst of a war on pause.
Yeah.
And so we are back and forth fighting this battle.
Our voices may sound a little different in a month or two. You might not recognize.
You may think, hey, they got 2 new people on here, and it's not. It's just we no longer speak in bass. So, but we do appreciate you listening to this podcast. And again, we will have further podcasts in the future talking about this very same thing, the idea of addiction, fighting the stigma. And so for myself, Shannon Childers, I thank you so much for listening. And my partner,
my name is Chris Strathy,
and we are
the Chemical
Brothers.
Brothers.